So yeah, questions are starting to build, so we're going to try to get to as many as we possibly can. Um, so we have a question from Ronnie Sue Allen, and the question is actually to both of you. Ronnie Sue, if you wouldn't mind unmuting yourself and asking your question.
Hi.
Hi.
Thanks so much for this talk. So I'm curious if each of you might address a question about what happens to the concept of the unconscious as we move from relying on Freud's notion of repression, which was thought as the cornerstone, right? To the relationalists who are now talking more about dissociation. So how does the concept of the unconscious continue to cohere?
John, do
You want to go first, Joe?
okay, sure. So I think that, let me just talk about the relational position. We'll leave Freud alone for a bit. But so that this idea of kind of the kind of dissociation means that it's kind of unthought known. You know, in other words, there's something there, and that we can see it in either the patients enacting it in various ways, but being unaware of it, or our own countertransference, our own experience, that we kind of feel things or know things. And so I think that to me, what is important about the unconscious is that we try to symbolize it. We try to find a way to symbolize it. I tend to like to think of this as kind of creating metaphors, which are more unconscious-like experiences. This is not something that John and I talked about, but I think the unconscious is like a dream-like structure. And you want to help the patient dream their thoughts, put it into some kind of dream narrative or dream experience, so that it's not so alien to them, and it doesn't have to be acted out. It can be kind of thought about, in an amusing way. So that's what I thought. I hope that's clear. Yeah.
So I don't see any fundamental conflict between repression theory and dissociation theory. They can both be operative at once in the psyche. And you have to recall that Freud's original model of the mind was a dissociative model, and he moved into a repression model later. And so this is not really a new thing. It's just being revisited. Dissociation in many ways is a failure at representation, a failure at being able to integrate the complexity of unconscious experiences, let alone articulate them in thought. So it can operate in many ways. And Jung also was one of the first to talk about the dissociability of the psyche. So I don't see a conflict. It just depends upon what we're getting at. People do remember things that they have repressed, and people do dissociate all the time. And then later that they try to put a meaning structure on it.
Well, I think that at least in Don Stern's work, he's pretty clear that repression doesn't have anything to do with what he's talking about formulating experience. You know, so I don't know, I guess, and people do talk about, you know, the difference between a vertical split, a horizontal split. I'm just trying to put that together and see, you know, whether it continues to make sense or not.
Well, does Don negate that there is repression that operates? He'd say there's no repression.
Well, I think that the central, his central theme is that there is dissociated let's just say experience that's not experienced yet, unformulated experience that comes into being for the first time in the interpersonal interaction, which is very different than Freud's concept of repression, where there's an actual thought, idea, representation that has been severed from consciousness.
Bonnie Sue, I'm sorry. I am gonna have to wrap it up because we have a bunch of other questions and only 7 more minutes.
Okay, sorry.
It's okay,
Sorry.
thank you, but I think we should, right.
Question, a great question.
It is a great question.
Thank you. I believe Danielle Nafo had a question. If you could unmute yourself to ask your question.
Yeah, hi. Thank you both very much. My question is for Jon mostly. Hi, Jon.
Hi, Dan.
I guess I'm thinking not just of your talk way back when with regard to critique of relational theory and practice, but also of your recent critique of the JAPA article with Don Moss wrote, and how you were shut down in both places. And you described how you were not allowed, both in person, but also in print, to retort, to answer your critics. And I know that with the Don Moss paper, which I'm sure most of you know about, on whiteness, which caused quite a brouhaha, but Jon, who is very courageous in my eyes and unafraid to speak up and to critique people within our own field, was shut down there too because he wrote a letter that wasn't accepted to be published. And so my question to you, Jon, is what do you think what are psychoanalysts so afraid of? What are they so afraid of? What are they so threatened by that they cannot allow an open conversation with criticisms, with differences of opinions? I would, and where do we need to go? What are these places that are, walled off and not allowing critical thinking?
Well, it's wonderful to see you again. But yeah, these questions, I think they have to do with, basic power differentials, that people think that they can intimidate people. There are people afraid of being canceled, people wanting to kiss everybody's ass. They only want their own ideas to be presented, and I just don't put up with that shit anymore. And especially when it violates academic freedom, when it violates important discussions that need to take place. When Don Moss says that every white baby that's born is racist at the minute it comes out of the womb, how could that get published? And then when Mitchell Wilson wants to shut the whole thing down, and this is a letter to the editor, what are you talking about? By the way, the paper is appearing in 2 other venues soon. So we need to open up debate, and it's okay if people don't agree, but you're not going to go anywhere if you don't.
But do you think it's only that people can't accept disagreement, or are there particular topics that trigger this reaction, or both?
Yeah, I think particularly in today's social justice movement, you have a massive amount of people who are putting pressure on the establishment that people don't want to be canceled, so to speak. They don't want negative publicity, and they don't want to be challenged by certain disenfranchised groups. So whether it be racial rhetoric that can be thrown around, whether it be the trans movement, as if anyone that says anything that, that they feel offended by other people is not open to discussion, to
Interrupt a second.
critique.
May I say something? Danielle, I think that that your question is really important, but historically, that's the way psychoanalysis worked. Jung was gotten rid of, Adler was gotten rid of. You could think of all of the people who were disposed of, and kind of in the psychoanalytic and the evolution, where we haven't passed. This is my belief. We have not passed like the kind of 13th century. We all have little fiefdoms and are afraid of kind of being known. I also think the fact that we work in secret adds to that, which I feel like the relational people have at least exposed more of the secretiveness than other groups. And I suspect that's why it's become so internationally popular. But I think that there is a way that we are unwilling, that baked into being a psychoanalyst is kind of fear of being criticized. And we don't, that's what I think.
Yeah.
Throw my,
I see it as a compliment.
a compliment of,
That somebody would go out of their way to criticize me means that I must have done something or said something that was of value to even motivate them to respond. So people should look at that as a compliment, that their ideas are being addressed and entertained, even if they're being looked at in a negative light by some.
But I think it keeps us very insular, and part of the problem with psychoanalysis and why people critique psychoanalysis
absolutely.
is because of this insularity and fear of having open debates. I lived in Israel, and people would get, they would attack each other at conferences and lectures. And here I go to conferences and this is a great paper, there's a great paper. And then they go out and they say to their friends, what a bunch of bullshit that was. So there is a fear of speaking up and of having open dialogue in these places or in print. So I think it's a shame. We pay a price for that.
Yeah.
We don't grow.
So we have like a couple of more questions. Do we want to like hold on for another 10 minutes and maybe hear some of these other answers? I think maybe if you're okay with that, I'd recommend that. And then we can conclude our workshop.
Sure.
Okay, we have a question from Brett Alderman. If you could please unmute yourself and ask your question.
Hi, John. I'm really loving this presentation. Could you contrast what you called an unconscious ontology with an approach like Derrida's, which attempts to deconstruct ontology?
Okay, well, the first thing is what I mean by ontology is that there is a sense of presence or being or existence, and that so when I refer to the unconscious ontology, I'm privileging that this is a real processual experience in our psyche. Derrida, however, has an entirely different agenda. So he wants to destabilize meaning structures and try to suggest, if not show, that you don't have any true foundation. So is he successful? Well, he's certainly interested in ontology, or he wouldn't be attending to this. I think that both things can operate at the same time, that you can acknowledge and avouch the notion that we are unconscious beings, and that things take place outside of our awareness, and they act out, or they materialize or appear in certain fashions or forms. We all know the different types, in our clinical work. But at the same time, we're groping for some meaning to anchor our experiences. If the project of postmodern deconstructionism is to do away with metaphysics, I think metaphysics always has a way to come back and bite us in the ass.
It seems to me like you could say that within that unconscious ontology is something that wants to deconstruct ontology. Like that's just part of our nature, maybe, is to want to turn back upon our assumptions and take them apart. But I appreciated your response. Thank you.
Good point, Brett.
Okay, we have a question from David. David, you want to ask your question? David H. Achelis. I don't know how, I apologize. I don't know how to pronounce your last name, David.
He's muted.
Oh, he's muted. David, you need to.
Okay, I
unmute.
got it. I got
Excellent.
it. I'm
Excellent.
gonna have to leave it. One of the, I internalized classic analysis. That's what I was trained in. And then I became a group person. The basis of it is how I got there and felt I wasn't betraying what I had internalized was kind of countertransference, and especially in induced or subjective and intrinsic countertransference. John, I'd like to just see how you differentiate that. I'm taking us backwards a little bit from the relationship, relation theory, which I think you have to embrace to do groups. Can you give me some ideas about how you did that? Or I assume you went through a similar process. I'm not sure about it, but from the way you're talking, I'm assuming you did.
I'm not sure I understand the question, David.
How did you get from the classic analytic and using countertransference to relationship? Did you use any of the different countertransference types of like induced or intrinsic countertransference issue? Because I felt that's how I was framing some of the talk you and Joe were involved in. Am I making it clear?
To clarify then, I believe that, countertransference is operating all the time, but do we actually act out it? I found the concept of projective identification really helpful for me clinically when I would realize I'm getting sucked up into something. I might not fully understand it, but use it as a guide. And so it does, this is what a lot of our work is, learning how to manage our own emotional reactions and needs to speak and needs to do and act in the treatment. So I think there's a great deal of value to the concept, and that's where a lot of the work lies, not all of it, but a lot of it does. How do we manage ourselves?
John, just to share something personal, when I was at Adelphi, you got your ass kicked if you're going into the group program. It has changed dramatically at this point and goes more to some of the concepts you're talking, much more to some of the concepts you're talking about and seeing the value of it. Thank you.
Okay, although we have a couple of more questions, I think we do need to wrap it up. It's really been a very lively and interesting workshop. I'm so thankful for both of you and for the audience for asking the questions that they asked. I also would like to thank Elizabeth Sullivan, our treasurer, and Danielle Eisenberg, our secretary, and Dustin Kaoud, the chair of the Meet the Author Committee, for all the hard work that they put into organizing tonight's event. But if you're not a member of ASPP, we'd like you to strongly consider becoming a member or to donate to our community. And for those of you who are members, stay tuned for more upcoming interesting events. Thank you, everybody, and I hope you enjoy the rest of your Sunday night.